talk about healthcare access, because especially as you get further north in the western part of the state,
Yes.
we've seen hospitals. I mean, it's amazing to me to think that in the year 2026, 2025, 2024, in the run up here, that we're seeing hospitals closing.
Yeah.
I mean, it's just unbelievable. And that folks, if they're having a baby, if they have any other kind of healthcare crisis, have to go hours in order to get to a hospital. It is a crisis in this state. What are your thoughts on that? What are your ideas in terms of trying to alleviate some of the issues where healthcare access is just becoming more and more difficult for so many Wisconsinites?
Well, first and foremost, I think that, as a Democrat, this is when I push to say we need that Democratic trifecta. We need Democrats in office that are going to focus on a new vision in keeping healthcare costs in check. And let's face it, like, a lot of these things that are happening right now is coming because of the dangerous policies coming out of Washington, D.C. And granted, there is $50 billion going to be spent across the entire country for rural communities. But let's face it, that is not enough to solve the problems that rural Wisconsin and many rural communities across this country are going to be facing. And so we need real leadership that's going to be focusing on how do we work not just directly with the federal government, but how do we fill in many of these gaps that we're going to see because of the decisions that are coming down the pipeline from this big, beautiful, ugly bill, for example. And so this is about how do we work together? We need individuals who are not just focused on policy. We need people who are going to be focused on people. Because if you're not keeping people at the center of the decisions that we're making, then the policy decisions are only helping to keep money in the pockets of those who don't need it in their pockets, which is, at the end of the day, helping to help billionaires and millionaires continue to keep more money in their pockets and putting those costs on us, those local taxpayers, or those who are in the middle class, which is constantly dwindling right now. And so I do think that we need real leadership. This is one of the issues that I'm going to be focusing on heavily, especially having 3 girls and how much reproductive health matters to me, but also having a mother, who transitioned a couple of years ago because of kidney failure. Making sure that people have access to healthcare that they need is extremely important to me.